Today, talk about, I'll just give you a basic introduction to diseases. This is where we would be in the Cowan PowerPoint, the textbook PowerPoint. They've got good stuff in here. I do it a little differently because I've been using this chart for a long time, and I'll go back and look at the Cowan chart. So basically, there's not a whole lot of images. These are the images, so it's not like there's going to be a ton of specialization. I want to give you an idea about some basics. So we're looking at them based on their genome. This is really what you need to know for this exam that's forthcoming. Is it DNA or RNA? These are, again, classifications of human. We use now they're calling them human viruses as opposed to animal viruses, specifically the ones that affect us. The genome, we're going to do DNA first, then we're going to do RNA. Are they enveloped or naked? Because that's a big deal about how difficult they are to control in our environment. Again, the naked ones are much more difficult to deal with. We're going to look at shape. To me, is maybe the least significant factor, but you should be aware of it. And then lastly, how they spread, and that's significant as well. And I mean, we revisit number one in the hit parade, human papillomavirus, good old HPV. It's not only about cervical cancer. It's not only about genital or venereal warts. And yes, it's a sexually transmitted disease. But for the most part, the most common presentation is a garden variety of wart. Whether it's on your foot, your hand, your nose, wherever it is, warts are everywhere. Okay, they are spread by not necessarily person to person contact. Though specifically when we start thinking about the ones and we revisit the sexually transmitted kind of warts a number of times. The most common way you get a wart, of which I have treated arbitrary thousands, typically on the bottom of the foot, which means plantar, which is the bottom of the foot, wart, is from having a minor abrasion that it doesn't go inside. Okay, warts basically they nestle in the third layer of the 5 layers of the epidermis. Okay, the stratum. We had the stratum basale, the stratum spinosum, we had the stratum granulosum. The last one that has a nucleus, is still living tissue, is where they nestle, and effectively it causes a kind of tumor. A benign tumor is effectively what a wart is. It's not magic. That's exactly what that is, okay, anatomically speaking. So, and typically what we would see it happen when people would, in locker rooms, going out to a swimming pool, it's generally spread by that kind of a contact. Typically, people would be barefoot. Okay. In the old days, if you went to, before they started using different kinds of plastics, you typically would have in a locker room or going out to a pool, you have kind of like burlap, like almost like a non-stick kind of material that was hardly plastic. I mean, burlap, you're dealing with basically a plant material. Okay, that stops you from, and it's rough, so you don't skid, and it would make little indentations. So basically, if the virus was on there, and the virus being a naked virus, very difficult to deal with. So I don't know how many, and this was from locker rooms at Y's, at public pools. All they were more afraid of slip and fall than they were necessarily of a wart, which is a relatively benign entity. Okay, comparatively speaking. So that's what I mean. In this case, it's surface to skin contact, if you want to think of it that way. It's true when we start looking more specifically at HPV with regard to genital, and by classification, it is spread by direct contact. So by that means, we really have to put it globally into what we call sexually transmitted. Because again, it doesn't have to necessarily mean intercourse. It doesn't have to mean necessarily mean blood or body fluids. They're all part of it. Frictional contact is sexual contact. You have to think of it. You have to think broader than what you may be there. when we get into talking more about the genital type warts and the problems that they are, it's just we subtype these, and we will look more at that. And then when you hear about the Gardasil and the other vaccines that are for this, they are basically formed to the most common types or subtypes. Okay, so there's a certain degree of variation when we talk about typing. With warts, with viruses, we talk about typing that are there, as opposed to the variants are like that. Okay, so papillomaviridae, papillomaviruses, they used to be incorporated with polyomas, but now we just call them HPV or human papillomavirus. The vast majority of these are benign entities. Vast majority. Unfortunately, it's extraordinarily easy to spread. As far as I am concerned, and I mean, from all the readings I have done, this would be to me, by number of people who have been affected and cases that keep recurring, this is probably the number one sexually transmitted disorder. Because once, effectively, it's one of those things, once you have it, you have it. Okay, the virus is there. Whether or not it presents itself again or not, I don't know. There's a lot of different things. And the difficulty with it when we talk about the sexually transmitted aspect of it, that's why I'm taking a little extra time with regard to this, is it doesn't, you don't necessarily have to be there physically visible. It can either be just going away or just coming on. And that's one of the difficult things that are there. It's an adult topic, and in an adult group, you have to present it that way to understand that a lot of times typical barriers like condoms don't necessarily cover the problem, if you get what I'm referring to. So we'll revisit this with skin when we do skin diseases, and we'll revisit it toward the latter portion of the course when we do genital urinary diseases. But for the time being, the big problem is it's a naked virus. Okay, if you think of what a locker room is like, if you think of what a gym is like, if you think of what a public pool is like, okay, it is unfortunately a moist environment. These survive very, very easily. Okay, so you have to be very, very aware of it. There's it's a totally different type of question. So some types cause warts, most types cause warts. We'll go into the typing in this when we look at them specifically in those two areas. And yeah, unfortunately, when I talk about that 15 to 30% of all cancers are directly related to viruses, this is the biggest player, 50%. Within the last 10 years, they made this into a separate category. It's also a naked virus. They used to be together. They had a fancy name called papilloma polyoma vacuolating agent virus, PAPOVA. Okay. It's interesting. This is yet another one of those skin cells. Remember the Merkel cells? Since you all basically had me for A and P, you should at least remember me talking about it. I know it's okay. You don't have to. There's four kinds of epithelial cells, right? The basic keratinocyte, there are melanocytes, the Langerhans or dendritic cells, which are part of the immune system. There's samplers and Merkel cells, which are special little cells that sit on top of nerve endings for soft touch. Now you know about them again. I'm not going to ask you about them again, but this interestingly causes a cancer. Jimmy Buffett. Any Jimmy Buffett fans here? Do you know him? He died of this cancer. Okay. Jimmy Buffett down in Key West, Margaritaville, a very well-known music, producer and singer and songwriter that was there. I'm a big Key West fan. My wife and I love Key West. It's a little different down there, but that's okay. Anybody been to Key West? No. The chickens run free. Chickens start doing their chicken thing first thing in the morning. We loved it. Okay. They are a protected species. You can't do anything bad to a chicken, it's big trouble for you. It used to be, historically, Key West used to be under control of Cuba back in the day, and they did cockfighting. It's a very nasty sport. And so when Key West became a U.S. property, they named the chickens to allow them to run free in the area. You gotta love chickens. Just saying. I thought that would be, you see, anecdotally, that would be interesting to me. Okay, they are also spread by contact. Okay, this is respiratory. This is an adenovirus. When we look at respiratory, so these three plus this one are naked viruses. Okay, they are all naked. They're isometric in nature, as is parvovirus. This one is spread respiratorily. Parvovirus is likely spread respiratorily. Adenovirus is a cold virus. The difference between adenovirus and a typical rhino, which means nose virus, is the degree of severity. Adeno means gland. So if you typically when you get a cold, you don't have a fever, you don't have the monster sore throat, you don't have the big swollen glands all over the place. Adenoviruses are that quote bad cold. They're a little more severe. There's lots of different ones of them. They don't all present the same way. That's the unique thing about viral upper respiratory infections. The most common diagnosis that's made for all people when they go to the doctor or go to an urgent care or go to their or go to the why they would go to the emergency room with a cold, I don't know. But the reality is mostly they're URI, upper respiratory infection. Okay, this is the one that's a little more severe than the typical common cold, which doesn't typically involve fever or that severe, oh my God, my throat is on fire. That one. I'm wagering that most of you have experienced this at one point in your lives or another. Okay, that's the adenovirus. And again, most of these we revisit when we look at the specific system. When we look at respiratory, we'll visit this. This is the only time you're going to hear about Merkel cells, and when it comes to HPV, we're going to hear a lot about it. Okay, in a number of areas. I'm skipping herpes. You'll see why in a minute. Okay, and so parvo, human parvovirus. We mentioned it before. Normally, when you hear parvoviruses, you hear about things that affect animals in kennels, and if your dog's going to go for an overnight stay at some kenneling facility or a daycare facility, they're going to have to be immunized for parvo. Fine. Okay. The reality is this is a skin disease that most kids get. All three of my kids got it. Okay. It's called fifth disease. When we get to skin diseases, we'll talk a little bit more about it. There were six very, very common skin diseases. This was the fifth one of the six with degree of frequency. Measles and scarlet fever were very, very high up on the list. Okay. So the fifth one down was this, hence the name fifth, the number 5 with a TH. And it was characterized by something that kids had very, very red cheeks. It was called slap cheek syndrome because they had this, what made the skin disease classification as the red cheeks that were there. For those of you who are interested in working in pediatrics, these are the kinds of things that you will see a lot of. So it's like somebody whacked the kid, which I know parents don't do today. So I'm fond of saying my parents did not get the memo. It's okay. Backhanders. But we didn't have that 1-800 for a child type of stuff. My kids would just hold up their phone and go, I'm going to get you, Dad. We're going to call the authorities. So you now have all the naked viruses. Why are they so common? And why are they so difficult to control? Is you have to use a strong disinfectant to get rid of them. And that's not something we typically do. Okay. We're sitting there cleaning them off. Maybe we're wiping and get the Lysol and the Clorox wipes. Don't do anything for them. Okay, be aware of it. Okay, you have Purell on your hands. Again, the mechanical action might help, but other than that, it's not having any tangible effect in the say of destroying these particular viral particles. Be aware of that. I will skip herpes virus. The two enveloped ones in the DNA family. DNA family is easy, by the way. How do I remember this? They're all isometric except pox virus, and we've eradicated smallpox. Smallpox, which is spread respiratorily, is in this category of other called pleiform. It's a very large virus. Remember me saying, even though herpes are a big virus, the pox viruses are larger still. So there is smallpox, there is cowpox, and I'm not sure, but I think cowpox is more of a contact spread virus because milkmaids before we had electronic or automatic milking machines that you see today, it was by hand. And remember that goes back to Jenner and the smallpox vaccine and all that type of stuff. There is one that is not in the list that we'll look at in sexually, believe it or not. This is another one of these contact sexually transmitted diseases. I know you're excited about it. It's got a great name. We get skin disease. It's called molluscum contagious. Believe it or not, it's just like HPV in a sense. You can get it just by, I've had patients with it, just by contact. So it's spread by physical contact. And that's how it is a sexually transmitted disease. It is mostly seen in the upper thighs of the partners because of frictional components of skin. It gets its name, contagiosum tells you it's spread for a reason. Molluscum is it looked like it's kind of like a red beige thing. It looks a little like a wort, but it's got a white center. So mollusk is a family that has oysters and clams. And so back in the day, they said, oh, this is kind of like the pearls that have a pearly white center. And that's how they named them. Okay? Molluscum contagiosum. I saw any number of cases of it. Something you might run into. Okay? If you were going to get a sexually transmitted disease, and I don't want anybody to have them, this is at least one you can deal with because it's very easy to get rid of. We used to basically numb them and take an electric needle called fulguration and buzz them. Okay, bye. Not that uncommon at all. So down the road, we'll look at that again. I'll have some pictures in the PowerPoint sequence that we'll look at. This is I want to go through the laundry listing today. That's the only one of the pox viruses that really is impactful today, and very, very limitedly so. Okay, so the fact that it's, and what this underscores, and we're going to get to that really just in about a second, because you're not going to want to see what I'm writing on the board, because there's a lot to write on herpes viruses, is that in that same category of pox viruses, we have a respiratory spread, smallpox, and we have basically a close contact, quote unquote, sexually transmitted in the case of molluscum contagiosum, and the same probably with cowpox being spread by contact. So the fact that they're in the same category doesn't mean they all spread the same way. Got it? Thus, herpes viruses, are you ready? Why do I do this last? Because I'm only going to put on 6 of them. Just one. You don't have to thank me, it's all part of the story. You're all looking at me. Yeah. They're classified as what we call human herpes. I gotta teach this stuff. Just give me a break. So we call them HHV. We do it by, there's a lot of abbreviations. So HHV and then a number like 1. So take that out of play. HHV1, HHV2, HHV3, 4. Good news, just 5. 6, and 8. So it's only 7 out of 8. Technically, it's all part of the service. Rule can be done. They're all enveloped viruses. They're not hard to get rid of in the environment. They unfortunately affect us a lot. This one goes by the acronym HHV. I'll get to it. HSV1, HSV2. That stands for herpes simplex. 1. This is herpes simplex. 2. Put your cameras on. This one is VZV. We'll spend some time with this over the weeks. Varicella zoster. Virus. 8. Look. It'll come to me inside. You don't want to forget anything. This one I shouldn't forget. I got it. EBV. Epstein-Barr. Okay. This one had 5. CMV. Cyto. Gallo. The Gallo means giant. So big cell numbers. And this is HHV6. Who doesn't have a name? Okay, per se. So we'll get it. There's nothing special. We just call it HHV6, which has diseases that go there. I'll bet most of you have. Okay, HHV8, same deal. We'll get it. So that's the first group. That's the abbreviation we typically use. What are they? Oral herpes, genital herpes, chickenpox, zoster, which would be the zoster, shingles. Most common cause of Epstein-Barr, most common result, mononucleosis. Cytomegalo, I would call it a mononucleosis variant. You do not want to get. Typically, it affects people with significant immune. Not okay. And this one, roseola. This one, Posies. Now we're getting into some of these. Remember, so far, the ones we've gone over, only HPV is associated with cancer. The big thing with DNA viruses, latents, meaning they incorporate with the nucleus of a cell, okay, and replicate along with it. So you're adding a genetic component that you don't want to necessarily have, but you're stuck having, with a cell, and it replicates along with it. Got it? That's what latency is. It doesn't always express itself. Once you're exposed to HPV, you got it. Whether it comes back or not, different. One of the things it does in cervical cancer is it damages those cells typically the cervical lining, epithelial cells, and that leads to cervical cancer. It's not exclusive, by the way. Okay, HPV is not exclusive to women. It affects men. To give you an idea, we get to sexually transmitted. I want you to understand that. Now, in this category, we have another player. We actually have 2 more players that are associated with cancers. HHV4, Epstein-Barr. It doesn't mean you have mono, you're going to get cancer. This is very prime territory for mononucleosis. Every year, I have a student or two, with 100 or so new students, freshman year in college. Statistically, that's a fine limit first. This one, osteosarcoma, is a cancer that is associated with AIDS. Indeed, it's what we call an AIDS-defining diagnosis. Diagnosis. So if, and that means if you're HIV positive, get osteosarcoma, they have it. Somebody with HIV positive, they get tuberculosis, AIDS-defining diagnosis. We will get to that when we start talking more about that virus, which comes later, but not today. We won't get to it. So, how do they spread? STD for these, oral and genital herpes. Without putting too fine an emphasis on it, you can get oral herpes in the genital area, you can get genital herpes in the oral area. I don't have to paint a picture for you to understand how it's spread now. Okay? But the reality is, the distinction is, oral herpes is very common. It's typically the common cold sore. Most of us have been exposed to that. Genital herpes is typically more painful, particularly the first case that's there. And again, you don't have to have it again. They cause a whole subset of other problems. For instance, just about 4% of viral encephalitis are due to herpes infections. Okay, what happens is herpes becomes latent what I mean by latency. Herpes becomes latent in sensory nerves. So oral herpes is going to affect things that you've already studied, cranial nerves. So typically when you get a recurrent cold sore, it's going out with the skin. Okay? What if it went back into the brain? Viral encephalitis. 4% not students, but people who get viral encephalitis, it is herpetic is the name we give it. Herpetic is a common term that you're going to see clinically. Herpetic. How common is it? My daughter had it. My daughter had started to develop stiff neck, headache, all that type of stuff. Next thing I got a call, I was kind of, this is maybe less than 20 years ago, 15 years ago, I think it was 09. And I got a call and she said, you better, maybe 2010, 2011, you need to be on call in case I might have to get my granddaughter to school. My granddaughter's now 24. She was diagnosed with viral encephalitis. They eventually she got readmitted to the hospital when they sent her home initially on whatever treatment. She got readmitted because all of a sudden it went redline again. Stiff neck, major headaches. She had a spinal tap, which was negative, which is the usual thing that they do lumbar puncture for this. That's something you may or I think we talked a little bit about it in anatomy and physiology. Eventually they put her on appropriate treatment, which is very, very good antivirals. Good news. When you get the therapeutics, there's really good antivirals. They put her on that. Thankfully, we talked. So when she talked to the neurologist, basically said, listen, it's like you had a cold sore that went in, just wear it. So if it can happen to somebody in my orbit, not 4%, around 25. Viral, not bacterial. The problem with viral, okay, is that it can pave the way for bacterial, or if it's not treated, it can go from meningitis to encephalitis, which actually that is good. Just a little clue. So these are spread sexually. It just depends, okay? And once you have it, you have it again. This is chickenpox. Don't have to worry. You all have been exposed to it. Because I'm wagering everybody here was immunized for chickenpox. And that vaccine became readily available. And I think part of the vaccine scheduling, I'm going to tell you, 1995. Up until then, until they had that, everybody got the chickenpox. So either you have, if you had the vaccine, which I think most of you did, you have now been exposed to the virus. The fact that understand, when you're exposed to a virus by way of a vaccine, it's called attenuate. That means they render it, not to hurt you, but you're going to produce an immune response to it and encode that so you'll make antibodies. You should be learning about that when you get to immunology. That's what vaccines typically do for viruses. So they basically give you, without giving you the disease, give you your immune system, put it on your immune system's hard drive to respond very quickly. They do. Really simplistic. The trouble is you still have the virus. It becomes latent, and when it recurs, which occurs in about 1/3 of all of us, we have another immunization for quote unquote shingles or zoster, you get shingles, which are ugly. We'll look at that when we look at skin disease. Interestingly, chickenpox is respiratory. Not sexually transmitted, respiratory. Interestingly, when someone has an outbreak of shingles, that they come in contact with a person who is not immunized for chickenpox, there's probably contact that they're top of it. But the most important thing for you to take home is respiratory, not sexually transmitted. Mononucleosis, Epstein-Barr virus, quote unquote, the kissing disease. Most likely spread to transmitted, saliva, etc., contact out. It is also one that is associated with certain cancers, rarely in this country, but they're typically in their nasal, pharyngeal, lymphomas, which are affect the immune system. Right? You don't have to, I mean, lymphomas by definition are cancers. So what you say lymphomas. Okay? Cytomegalovirus, not sure how it spreads. Typically, these people are immunosuppressed. It presents similarly, okay? And someone who is already ill is something that's a pretty severe kind of mononucleosis. We'll look at mono a little bit as well when we start looking at diseases in that area. Mononucleosis, what it does, did you guys have blood yet, AP? Mononuclear cells, you have two mononuclear cells, lymphocytes and monocytes. It causes a vast number of them. Okay, so many of them is typically really compromises your immune system's ability to deal with things. Also tends to cause enlargement, particularly in the spleen. So people are really at risk of rupture of the spleen. And because there's so many of it in the bloodstream, the fatigue is alarming. And so it's worse, and it's really worse the older you get. A lot of these diseases that occur younger, people in high school and in first year, you're still fairly strong immunologically speaking. A buddy of mine, when he was my resident under, my junior resident, I was a senior resident, it's horrible. I mean, he was, I'm going to tell you, 27, 28 years old. I mean, just a few years older, I mean, months. My first wife also had a recurrent mononucleosis, and she had it when she was like in high school or in nursing school, and ended up, I mean, she was in bed for 6 weeks. You're basically, she could go to bed. That was the highlight. He had 3 kids in diapers at the time. I hired full time. Just to give you an idea of the severity. We'll talk about chicken pox. It's more, these are not innocent. People are learning today that we used to call the usual childhood diseases, measles, mumps, German measles, and chickenpox, are hardly innocent. Most people in this country are not troubled. Other areas, very much a number of them. That's just part of the process so far that's here. And so that really only leaves us with 2. You'll be happy to hear me stop talking. Oh, I got plenty of time. And that's this. And frankly, I'm not sure about how these spread. I think roseola is most likely respiratory. I'll bet most of you have had it. Roseola. We get to measles. Measles name. German measles is rubella. Measles originally was rubeola. It all had to do with the color of the rash. Ruby red was measles. Rose colored was roseola. So it causes a degree of redness. Typically, I think the Latin they give it erythema infectiosum. It presents a little bit like measles. We'll look at that in one of those diseases that are in one of those lists of skin diseases. Interestingly enough, statistically, more than 90% of us have been exposed to this when we were kids. Well, my kids, just like they had that slap cheek syndrome. What's interesting about this, when they're studying this, there's a correlation. And correlation doesn't mean cause and effect. There's a high correlation between this and MS, multiple sclerosis. Because multiple sclerosis is an autoimmune, we wonder if there's a viral component that has somehow done something to our immune system. Okay? So that's a big deal. And then lastly, it's hard to know AIDS patients, HIV patients, their immune system is so bad. This is an odd disease. We'll look at it again because HIV is one of the viruses we study. Normally, this is a virus that would not trouble us. So someone's immune system has to be so severely suppressed that they get this. Okay? Met by an age-defining diagnosis. The reality is HIV really didn't show itself. It was, and it's an emergent disease that we'll go into what was sort of the genesis of it. Surely no earlier than the 60s, and then became really notorious as you got into the 70s. And then finally, a name was given to it in 1981. Kaposi sarcoma appeared in medical literature in the 1800s. So this particular kind of cancer, and it shows up as this, looks like a skin cancer that really involves blood vessels. That's as much as I can give you about that now. You gotta stop eating like this. Get more. Are you guys sick?
No, I'm not sick. I really was trying to take the charger out of my MacBook, but this charger's so like stiff that I had to like rip it. Whenever I ripped it out, I elbowed this, and then it spilled everywhere.
Okay.
Like, why wouldn't my Monday be like that, right?
It's Monday.
It's okay though.
It's all right. It's okay. It's all right. The comic relief is necessary when I'm talking about serious stuff. All right? It's okay. All right. Are you so that is the herpes viruses. Aren't you happy you came today? I have 10 minutes. You know what that means? We have time to continue. Yeah. It's okay. I'm not I don't have to be your best friend. RNA viruses. I'll make life easy. We'll look at the first three. Those are naked viruses. Okay. We'll say picoRNA. Pico means teeny tiny. Okay. Naked viruses, big problems. Okay. Norovirus used to be called Norwalk virus. They're all isometric. It causes severe gastroenteritis, diarrhea, vomiting, etc. The next time you hear about a cruise ship being turned around because everybody got sick, norovirus. Norovirus closes down school districts. Ringgold, which is in Mon Valley School District, most people are familiar with. Who knows if maybe anybody went there? Okay, back about 20 years ago. It's small, so they make all the meals out of a common food service and send it to all the X number of schools. It turned out there was norovirus, and it got to the point where more than half the kids and half the faculty and staff, and they for 2 weeks they had to close down so people got over it. It's that kind of it's one of those ones where you're starting to get sick before you know. In other words, you're contagious. Okay, so that's one of those that's fecal to oral. Somebody's starting to get ill. Maybe they weren't careful washing their hands back 20 years ago. Who knows if they were wearing gloves and all that stuff consistently in the food service. I'm not trying to be mean about anything like that. I'm just telling you that's the kind of thing that happens. And the next thing you know, and on a cruise ship, you're contained. All that food is coming out of a giant central kitchen, going to all the different restaurants and buffets and stuff like that. And once one person gets sick, then all of a sudden they're sick. Maybe they don't realize how contagious it is. Maybe they weren't careful with their hand care. Maybe it's the kids who's on it. And the next thing they're putting their hands that aren't clean on areas and you're touching them. And remember how many times you touch your face. And the next thing you know, you got 1,000 people who can't get out of the bathroom. I don't mean to make it sound so vulgar, but it's the truth. That is norovirus. This one survives for a long time on surfaces. That's why it's such a problem. Rio, human rotavirus. This is endemic in Mexico, Central America, border states to there, like Texas. Okay. It is, interestingly enough, it's something they talked about with COVID called herd immunity. After a period of time, if 90% or so of the people have been exposed and recovered, at that point, there aren't a lot of people to transmit it. So the only people who would be at risk are people who, and typically it's called the infantile diarrhea disease. It's usually infants. So you need, if for many of you, when you become parents, if that's what you want to do, you got to be careful when you travel with young children. So I can tell you an anecdote about a couple with a 10-month-old child who went to visit their very close friends in San Antonio, Texas, to celebrate New Year's, and spent what was going to be a 10-day fun vacation, spending 7 of those 10 days with their child in Santa Rosa Children's Medical Center in San Antonio. Now, why they didn't look up on the CDC website, considering one was a doctor and the other was a nurse, and they had just spent 5 years trying to have a child and adopted this child, I don't know. But that was us, as you may have guessed by this time. And they had to do a spinal tap on him. We were deathly worried. It was 104 fever. He was vomiting and diarrhea everywhere, all because we weren't smart enough to be careful where you travel with young children. He had rotavirus. Thankfully, it was just, there's no treatment. It's just supportive care, IVs, fluids, whatever you need to do. Basically, it's fluid restoration and hoping the immune system does its thing, which it did. The point was it's and particularly susceptible because the immune system takes time to develop. That's what happened to my oldest, who is just turned 43. It's a long time ago. That was us. To give you an idea, it can happen to anybody. Rio, it used to be called respiratory enteric orphan virus. That's where the Rio comes from, not Rio Grande. Okay. And that leaves me with one more. I'll tell you what, we'll start with that because it's too important a category because of polio, colds, and hepatitis A. We'll leave it there, and I'll remember to start with picoRNA viruses. Thank you very much. Can't tell you you're having fun. What is he talking? Hey, hey.
So, like on the exam, like we're gonna need to know like which ones are RNAs.
Yes,